Hello, everybody. We are here today with Wilbour, and he's going to talk a little bit about his experience with Fascia. He works a lot with runners. So, Wilbour, can you tell us a little bit about your background?
My background, well, I was trained as a kinesiologist, and then I entered into school for I did my undergraduate in kinesiology. Then I went to medical school to do, and I did study chiropractic first. And after a 5-year program, did my internship into clinical practice. And then I moved on to do sports medicine. I did a fellowship in sports medicine, which is a specialty in sports medicine, and then a specialty in rehabilitation medicine. So I did 2 postgraduate fellowship specialties, and that's basically my educational background. And I run a clinical practice, but I also got involved with working with athletes at a very high level, but also starting at working with just the average ordinary athlete who is just trying to have fun. Okay. And I work with a lot of coaches, high level coaches, people who train Olympic athletes, who train NBA, NHL, hockey, and football, also football coaches. And over the years, that's where I get a lot of my experience, is working one-on-one with coaches and athletes at a very high level. I've learned a lot over the years. I have a lot of mentors in the field of sports medicine, in the field of coaching, and athletes, and obviously my patients also. They're great mentors. So I come from a very wide background in terms of my education and my practice.
Okay. And when did you start working with Fascia, Wilbour?
Well, I think I always worked with Fascia once I got into body work. I think as I always say, the concepts around Fascia is the concepts around Fascia and the understanding of some of the things are new to us. Because when the work that I do now, I have been always doing that work. I didn't understand a lot of it though. I was getting results, and I was fascinated and blown away by the results I was getting from some of the work I was doing, and I didn't have sometimes the right explanation. I think getting the knowledge as to the classification of the tissue, or the concepts around fascia and tensegrity and biotensegrity, I think I've been in the last 10, 12 years in terms of understanding the concepts and the science around it and trying to correlate it with what we have been doing. So we've always worked with fascia, because we always work with tissue. It's just that we didn't have the right explanation or the right terms to use to explain what we were doing. And I think now that we have this, now that we have the science to back it, now that we can see things a little bit deeper, we can see things in a little bit different microcosm, we have better explanation for what we're doing and why we're getting those results. And we can now improvise even more. Mm-hmm. And this is what I'm finding fascinating, is that I can improvise even more now, because I understand. You know, when you understand something, you're not fitting everything into one box, you know. Everything doesn't look like a nail because you have a hammer. Because now you can create, you can be creative, you can become a real artist, and you can expand, and you're not scared anymore of venturing into new ground. You know, in the old days, we do stuff and we get good results and we say, wow, this is awesome. And you listen to the other practitioners, you know, who are older than you, who have experience, and you learn from them, and they give you an explanation, but it's maybe not the right explanation, but you're still very cautious, and you're sometimes a little bit timid to take a little further step, you know. Now we can step out a little bit more because we have evidence. We have the great work of the fascia research people, like the University of Rome and of Robertson and Tom Finlay and Tom Myers and, you know, Andre and the Steckos, and you keep just naming all the great people who've been doing all the great work in fascia, and Gill, Headley, and all of these different anatomists and that people who are doing all this great work and discovering all of these great things. So we can now use that experience, use the research from these individuals, and venture out and become more creative and become more of an artist. Because working with the body is about being artistic. This is an art. It's not just about science. It's an art. And you can create, because tissue or fascia or connective tissue is, in my terms that I like to use, is infinite in its ability to adapt. And this is how connective tissue is able to survive, is because of this ability to adapt to different situations. And this also relates back to the concept around biotensegrity. Mm-hmm. And this is why we can do different things, different forces and all of this stuff. There's not this linearity of forces concept does not apply to our human existence, right? Because we have the ability to adapt, I think, in an infinite way. So
I totally agree with you. Once we are aware of how it works, we are able to create more exercise and really use our creativity in order to do different things. So when I met you in Ulm University, maybe 3 years ago, you were working with runners, and I remember you gave a lecture about runners and working with fascia with them. So can you talk to us a little bit about that? How is your experience with integrating fascia work into runners, and what can we get out of it? Why is it better doing like that?
Well, I think from the knowledge we have now, it's fascinating to really, for me, working with running or with movement, I would say. And I work with not just runners, but I work with, you know, wrestlers and basketball players and any type of sport. Running is very interesting, because the whole concept about running is about moving from point A to point B. That's what you want to do. And you want to do it in the most efficient way. And you want to do it with least trauma to your body when you're doing it. And this is how it works in nature. What I found with understanding the concept around fascia is that we can use those principles in terms of fascia and the characteristics of the fascial tissue, of myofascial tissue, to enhance and to improve efficiency in movement and to help us to rehabilitate better. It also helps us in terms of diagnosis of problems or injuries. Now that we understand the concepts and the science around fascia, or some of the concepts, I should say, and some of the science around it, we have better ways of, number one, examination, in the way we examine a runner, in the way we prescribe training concepts, in terms of training to get them prepared for the activity, and in the way that we also diagnose problems. And these are three important concepts. So rehabilitation, examination, and conditioning, basically. We use the knowledge we know now, and I can give you an example. We talk about the connectivity of the body. We talk about the global concept of everything is connected in simple terms. We now know in training that doing segmental training for a runner, for example, is not, when I say segmental training, if I want to strengthen the runner's lower body, that I know that I don't put them to sit on their butt to do leg extensions if I want to strengthen the lower body, for example. But I don't just strengthen the lower body, I strengthen the whole body. But I'm just saying an example of that. So we can base our concept and say, this is not the right way to do it, because we're disconnecting the lower body to the upper body when you sit on your butt. And when you're running, you're not sitting on your ass. Oh, excuse my language. I can say that, right? It's okay?
Yes.
Okay. Okay, we're in Canada. We can say that. Well, this is for Brazil audience, so we can say that in Brazil, right?
Yes, sure. Don't
Okay. I'd like to say it in Spanish or Portuguese. So you can tell me how to do that. So we design a program that involves the whole body. Because in the old days, you see people trying to strengthen their quadriceps by sitting and doing leg extensions, which we know is just totally detrimental, number one, to your knee, and it's not as effective. The crossover, what we call, when you do an exercise, the benefit of the exercise is reduced if you don't use the similar movement that you're going to do to benefit from the exercise.
Mm-hmm.
So with our understanding, for example, from Tom's work, Maya's work, where he talks about the anatomy training, the connectivity of tissues, the relationship, with your hamstrings to your gluteal, to your thoracolumbar. We understand this concept now. So our training and the way I train people, and which is the way I have trained people, I have an explanation to say, that's why this works better. That's why somebody with knee pain most likely have weakness in their gluteal muscles. So when we're training and designing a training program, we take these things into consideration, right? So this is a really good example of where we're using fascial concepts to train tissues. Okay. The other one would be in the elasticity of the tissue. When you want to train elastically, for example, running is an elastic event. Running is not this muscle powering event to be efficient. It does a number of things. If you use the elastic nature of fascial tissues in running, you decrease your energy consumption, you decrease forces on your joints, you decrease injuries, and you become more efficient and more powerful in generating force to get to the next point you're going to get to in your running. Mm-hmm. So we know of the behavior of the elastic behavior of fascial tissues. So we can design programs which is going to enhance these elastic behaviors. And that's what we teach in our running courses. That's what I teach. And I have specific exercises that we do for those things. So these are just two examples.
Okay, so we can summarize saying that with strengthening exercise, you guys, of course, don't work with separate muscles. You think about the whole sling of chain, right?
Yeah.
Also,
we are global. I like to use the term global. Yes. We think of the whole body.
A whole body.
Because the whole body is involved. Yes.
Exactly. Yeah. And you are also very careful in order to train that person in their gesture of the sport. Like if you're running, why are you going to train these people laying down or sitting? You might as well train them standing up.
That's right.
And yes. another
specificity. That's called specificity. Yeah.
Specificity. And another point is you also train a lot of recoil of fascia, because running is much more about recoil and like saving this energy in the fascia and then using when you are running, so you can decrease the amount of energy you use when you're running, right? And
it's called elastic. Elastic is about impact. It's about kinetic and potential energy. So this is the term. So you're basically, what you're doing is energy storage and energy release. Energy is neither created or destroyed. And your body has joints, and there's certain, joint angles that are more apt to producing elastic tension. All right? Yeah. Running is one of the most beautiful things to describe biotensegrity and fascial tension. Because in running, you compress and you tense. You're creating compression and tension, and it's a constant cycle of what I call it shunting. On, off, on and off switch. On, off, and that's how you gyrate yourself through a running cycle. Tension, compression, and you move through that cycle and you're just hopping along.
Okay, so then you're storing energy and you can use that energy, right?
That's right.
And of course, by doing this kind of training, you have noticed that your athletes have a better performance and also less injuries.
Definitely. I'll tell you something. There are people who come in with injuries, right? And we all about, we are doctors. We're all about treatment. We want to, okay, you have an injury. You got an Achilles tendon problem. Let's treat it. Let's massage it. Let's put ultrasound. Let's put electrotherapy. Let's put anti-inflammatories. These things are what we are just immediate emergency care, because these don't solve the problem.
Exactly.
If you would take and go find the cause of the problem, why does this person have an Achilles problem? We'll find that most likely it's the technique, it's the way they're running. They're not using the Achilles tendon appropriately.
Yes.
It might be their footwear. Their technique, instead of using the Achilles tendon to store energy and release energy, they're not doing that. The Achilles tendon is not storing energy and releasing the energy. The Achilles tendon is just absorbing the energy, and that causes a huge amount of problem. So the mechanics and the technique is wrong. So what we have to do, now that we understand the concepts around fascial chains and fascial connection and the whole body concept, we can now change the technique. When you change the technique, you decrease the forces. You decrease the torsional forces in the system. And right away, the injury will get better. Mm-hmm. So this immediate little stuff you're going just to control a little bit of inflammation is okay. But it does not solve the problem, because that's why these people keep coming back again and again if you don't solve the problem of the technique. You know what I'm saying? You have to reduce the stress, the abnormal stress, because most connective tissue injuries, or most injuries in these joints and stuff, are connective tissue type of the white connective tissue. And they're usually due to torsional stress in a way that the connective tissue is not designed to take. So it overloads the tissue. And every tissue, every material in this world, based on mechanical concept, that's where mechanics come in, has a certain tolerance for load. Uh-huh. It fatigues. And when it fatigues, the molecules will break down. And when the molecules break down, you have tearing, you have stuff. Same thing happens in aeroplanes. You got fatigue fractures in aeroplanes. We got fatigue fractures in our tibia if we overdo it. Mm-hmm. If you run too much, we have stress fractures. So fatigue in the tissue will lead to failure. And this is a basic biomechanical law. We know that happens, right? And based on our tensegrity model, fatigue can set in when we disrupt that harmony on biotensegrity forces. If we disrupt the normal biotensegrity flow, we will develop fatigue much sooner.
I see.
Which will cause problems.
So I heard there's a Congress coming on March next year in Canada. I think it's in Vancouver. And
yes, right.
And you will be part of it, right?
Yes,
so
I am.
Are you going to be teaching this? I mean, running and fascia, or is there any subject that you're going to be teaching?
Well, I think that the whole idea behind this workshop is to kind of put the concepts of fascia and biotensegrity into practice. We want to show people the techniques that we use to the principles of biotensegrity, the principles of fascial fitness. We want to use those principles in practice. So we will be showing you exercises, examination. How do you use different techniques to enhance and get the most efficient behavior from an exercise or from an activity?
So there's a lot of practicing and a lot of hands-on.
Lots of practical. The workshop is set up so that majority of it, I would say 80% of it, is practical.
Oh, awesome.
We have in the morning, there will be a lecture. There will be a keynote speaker, like Robert Schleip will be speaking one morning for about 45 minutes to an hour. We have questions after his topic. Then we break up into groups and we go into practical work right through the day. On the second day, we have a panel at the end of the day for about an hour. The third day is exactly the same thing. And then the second day, there's also Dr. Stephen Levin will be speaking in the morning. And on the third day, we also have we have some guests speaking for an hour. There will be an hour and a half lecture, hour of speaking. That's it. The rest is all practical. With Joan Everson, with John Sharkey, doing his work with training and ropes, and I'm Joan doing her stuff with stillness and with a concept around yoga and fascia and all the different ways of trying to understand how we can integrate the concepts of biointensity in movement and stillness.
Great.
So it's a kind of a potpourri of practicality around fascia and biointensity. We understand all this stuff about fascia. We understand all these concepts, new concepts around biointegrity. How do we put that into practical practice? And this is just the tip of the iceberg.
Good.
You know,
I'm really looking forward.
Taking this avenue.
Yeah, I'm really looking forward to go.
Well, we'd love to have as many of you as possible. And you have to register quickly because it's getting, you know, it's
coming out quick.
Good to have, you know, we know you know, that people are really interested. We have a lot of interest in the program, so you need to get your spot.
Yes, I will. And especially because after that, I'm going to go to Whistler to go snow skiing. So wonderful.
There you go. Yeah. Whistler is a wonderful place.
I know.
To snow ski.
So let me ask you one more question. Are you really into any research right now?
Well, yeah, I have a few research ideas, and some of them I'm just in the preliminary sort of phase of writing them down and getting the concepts right and talking to people and testing a few of them out. Some of them have to do with aquatic therapy and fascial behavior and tissue behavior. We've been conducting some studies in my clinic, just anecdotal studies, and we have I have an underwater treadmill in my office, and I've been using that to conduct some studies in-house. I have some interesting concepts that I want to investigate in terms of force generation and actually measuring the force generation and using different techniques in running and so forth. So this is where we're using elastic nature of fascial tissue, looking at that. So I'm using some biointegrity concepts. So there's a few things in the works that I've been talking to a few colleagues about out here in terms of undertaking.
Okay. I remember when we were in Ulm, you presented an article about water exercise with a treadmill. Is this like the continuation of that research? Yes.
Definitely. Okay. It's the underwater treadmill concept and running in water is an incredible concept, and it's an aid in terms of fascial tissue. You know, there was all of these concepts around water, and the Greeks use it, the Turkish people use it way back in the Mediterranean, culture. There is a reason for it. Water is absolutely, it's not just about ions going into the skin. There's a physical aspect in terms of how it affects tissues, and it's fascinating to try and find that out. And I'm desperate to try and find it out. I'm fanatical about it. Because I see the results, and getting the correct explanation can help us even so much more, as I said before at the beginning, into being creative with it. And we see the benefits tremendously in terms of tissue regeneration, post-surgical. It's fascinating, and some of the explanations that we have for what's happening makes a lot of sense because it ties into the science of fascia tissue and how, you know, mechanotransduction and stuff like that, how all of that works, you know, how tissue regenerates and the importance of forces to cause these things. So,
wonderful.
it's very interesting.
Good. So, Wilbour, our interview is coming to an end. Would you like to say something else or to add something that you haven't said yet?
Well, I want to tell all the people in Brazil, we welcome you to come to Vancouver. Come to our workshop. Come and see Vancouver and come and learn some concepts, some new concepts. Come and share. You maybe have something you want to contribute. We'd love to know. I want to learn some new stuff, right? I'm in the process of learning. This is what life is about. I would love to share what I know, and I want to get new input. Mm-hmm. And I think it's a good avenue. It's just the beginning. I think that in terms of trying to get the word out, trying to get people excited about the concept, about the new things that we are learning about connective tissue and its behavior in terms of medicine and in managing illnesses and so forth. There's a lot to learn, and I think we can only get better if we get together.
Yes.
Right?
We all learn together. Yes, you're right.
Yes.
So I'll make sure I leave the link for the Congress so everybody can get to the link and do their...
Yes. Biointegritycanada.com. That's it. You go to the website, you'll get all the information. And if people have any questions, they can always email me at wkeiseck@hotmail.com. All the links are there for information on the website anyways.
Okay. Go soon to do the registration before it finishes, right?
Yes, we want to encourage people to go to the registration as soon as possible, because there are certain cutoff points. There is a early bird registration, which I think is very good in terms of costs. There's a student registration. There's group registration that people can, if you register 5 people, you get a discount. So we try to make it as affordable as possible, because we want people to come from afar, and we want to start developing this family. We want to start putting all our knowledge into practice, and this is what this workshop is about: putting your knowledge into practice.
Great. Well, Wilbour, thank you so much for your time. I really appreciate.
I want to come to Brazil.
Yeah.
I love Brazil. I've been there many times. I was there for 2016 for the Olympics. I was there twice before working with wrestlers. I love the people. I love the music, and I love the food.
You have to come back
to coconut water. And, I love all of that stuff.
Do you love caipirinha?
Yes. I drink a little bit of that.
Yes.
I drink it with coconut water. Get me to Brazil. I'll come and share with you guys.
Okay. Well, thank you so much. And
you're welcome.
I'm going to make sure I'm going to spread the word about the Congress. And one more time, thank you for your time and for your generosity to share your knowledge here with us.
Anytime. I would love to share. We can talk about different topics. We can manage different segmental topics and stuff. That's not a problem. I'm willing to share. I would love to do that. And we can have a question and answer period, whatever. We can do a little bit of that. That's the whole idea. With our new media now, I'm not the best media person, I have to tell you. I'm terrible. I'm awful, terrible. But I will learn. I'm willing to learn. And I'm getting the nudge from people. And I love to teach. So let's do it.
Okay. So I will see you in Berlin.
Yes, I'll be in Berlin.
Okay. So I will see you next month then.
That's right. I'll be in Berlin.
Thank you very much. Bye. Ciao, ciao.
Bye-bye.
Bye.
Have a good day.
You too.
Bye to Brazil.
Bye.
Bye.